as well. My machine is here and it's getting set to do a red cell exchange. This morning they placed a Vas Cath on me. A Vas Cath is a catheter that goes in the jugular vein, and it's done for red cell exchanges in the sickle cell community. It has 2 ports. So one is to draw blood in red. The other is for the new blood to go in, or for dialysis, the washed blood to go in. For individuals that have sickle cell, a red cell exchange is done pre-operatively, and it all depends. Every patient their care is individualized. So ASH has certain guidelines to meet for transfusions, and it depends what type of surgery that you're having, from mild to moderate. And it gives guidelines on what to do and what type of transfusions are recommended and for what type of baseline. So although I normally run a high baseline, because I'm having a hip surgery, what they recommended is to do a red cell exchange, because a red cell, it doesn't change volume for a sickle cell patient. So if you come in with a volume of 7, when you get a red cell exchange, you don't come out at 9. You receive 7. Volume stays the same. The purpose of a red cell exchange is that it reduces your S percentage. So in the case of surgery, this will be a preventive measure post-operatively for persons to probably not develop acute chest syndrome while they're recovering, as well as a vaso-occlusive crisis during their recovery. The exchange doesn't necessarily mean that you will not endure pain or go into crisis. Everyone is different, but it does protect on you, hopefully not developing. The main threat to our health is acute chest syndrome, especially while recovering from a major surgery. So just wanted to do this quick informative, as I'm hoping to advocate and assist, especially my Hispanic community, because there are things that are not used in other areas, but it's always good to know, especially when one is to have surgery, and know what preventive measures to take. So does a Vas Cath hurt? For me, no. It's more uncomfortable than pain. This is done through radiology. It's done by the department that also does PICC lines. You are taken to radiology, you sign a consent form, and then you're placed on the table and they drape you. So you're practically covered, and it's an MRI guided. So you're not able to move, and they place some items so that your arms can stay still. They put a EKG monitor. And then the first initial step is the radiologist. They introduce themselves, the team introduces themselves, and then they put lidocaine. Lidocaine is a sting and a burn. That's as most is what you're gonna feel, is that burn and that sting when the lidocaine is being placed, and you feel it go deeper. That's about the extent of pain. Then they let you know that they're inserting the catheter, which you do not feel. And then what you do feel is pressure when they're done placing the cath, and then they stitch it to your skin. So you feel pressure when that is done. And then this has 2 outputs that they'll use when they do the exchange transfusion. It has 2 outputs there. But as far as the catheter goes, it's more uncomfortable because of the way you're taped. And then when the lidocaine wears out, you feel it a little bit. It's a soreness, but I will not say that it's an extreme. We're used to pain, so pain in my scale, this is probably a 1. So hope that gives you a little bit of ease if you're getting a Vas Cath placed for your transfusion or dialysis. Praying for your health. Take care.